all right. Yes, 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 yes. Hey, good evening, everyone. I'm very excited to have you back on here. Really glad. Uh, First of all, I'd like to apologize for the very last session that we had. We had a lot of technical difficulties. Also, again, today, it, it seems to be similar. But then we must go on. All right. So we're here on the show today and we're going to be talking about rabbit diseases, inorganic and organic solutions to rabbit diseases. Okay. And if you were here part of the last live, you would remember that we introduced the guests. But of course, we'll definitely go ahead to introduce the guest once again. All right. So this is someone who is really really active in the coniculture space, who has actually you know collected and owned a lot of knowledge. And yeah, I've had a few conversations. We've actually had a session with him. Of course, if you at the end of this video, of course, you could just go through our older videos and look up our interview with him, the session. I think there are about two sessions also, but then you can find that on our profile, of course. Yeah, so without further ado, without taking so much of your time, we're going to dive straight in. So we're just going to be back immediately after the introduction. Yes, see you in a short while.
My name is Oswa Emmanuel Adeiza. I'm the founder and the farm manager here at Adeiza Rabbitry. Adeiza Rabbitry was birthed out of passion for animals and was established for the purpose of creating a niche in rabbitry and coniculture. I had my first set in about 2016, so we've been running operations on this farm for about 10 years now. So here on the farm, what we do is we raise rabbits for meat purposes. So we give orientations, we run trainings here on this farm, and we also supply manure that comes from the rabbits, which is organic. So we supply it to grain farms and local farmers around. We have a vision of impacting lives with what we're doing here in terms of empowerment and job creation. I have been keeping rabbits, not in terms of business though. My name is Oswa Emmanuel Adeiza. I'm the founder and the farm manager here at Adeiza Rabbitry. Adeiza Rabbitry was birthed out of passion for animals and was established for the purpose of creating a niche in rabbitry and coniculture. I had my first set in about 2016, so we've been running operations on this farm for about 10 years now. So here on the farm, what we do is we raise rabbits for meat purposes. So we give orientations, we run trainings here on this farm, and we also supply manure that comes from the rabbits, which is organic. So we supply it to grain farms and local farmers around. We have a vision of impacting lives with what we're doing here in terms of empowerment and job creation.
Okay, welcome back, everyone. Welcome back to the show. Yes, so that is Adeiza from Adeiza Rabbitry, and yes, we have him on the line currently. I'm particularly excited to have him on the show. We are really, really excited. So we're going to be diving straight into business. Mr. Adeiza, good evening. Good evening. Good evening. So we already went ahead to give a brief introduction, yeah, to the audience. But then, if you have any, further things to talk about yourself, at least for the sake of those who are just meeting you for the very first time, it won't be out of place for you to, introduce yourself. So, one more time, could you just let us know who you are, what you do, and what drives you?
Alright, so good evening. I take not for granted to be speaking here this evening. No further ado, my my name is Emmanuel Oswa Adeiza. A zoologist here and a rabbit breeder. I think that will be very brief, but this is just a brief introduction of myself here. So I've been breeding rabbits for quite a while. For I'm glad that we'll share knowledge together. I'm on this live session and restricted time we have that to be the thing for me to be here.
All right. So we're already far behind time. So we're definitely just going to jump right straight in. So yes, organic and inorganic solutions to rabbit diseases. Okay. Um how do we do this? You earlier we were talking and you sent in a list of a few diseases, right? So how about we, just take them step by step, one after the other, and then just trash them out as quickly as possible. So I call them out and you give your approach to, of course you describe, and then we would on this end display what it looks like to the audience, and then you can just talk about it briefly, how you treat it, how you would approach it organically and inorganically if there is any option like that.
Alright, alright.
Yes. So the very first one we have on the list is ear mites. So I'm just going to go ahead and display that on the screen. Of course, you have the floor now, sir. Ear mites.
My network is a little bit cracky. You said um what what disease are you talking about?
Ear mites. Mites.
Okay, ear mites, ear
Yes,
mites.
sir.
Okay. So ear mites is it's an ectoparasitic disease where it's very frequent during the hot weather and with farmers that practice deep litter systems. The reason why you have um, ear mites is because the ear canals of rabbits are very humid, so they have that tendency to, um, inhabit um, ectoparasites like mites over there. So what you want to be um, cautious of is checking the ears and knowing if those ear mites have started building up. So what you just do with ear mites is that they have like cat kind of system, just like you have in colonies and what have you. So as the inhabit in the ears over time, they start to build their cast, which will be a visual cue for you to see the ear canker, coming up, building up within the ear canal. So not to mention much, when you observe this, usually give ivermectin. So ivermectin is, let me see, with the dewormer and also a medication you give to treat against ectoparasites like ear mites, and maybe you have things like mint, which we might talk about if we have that time. So that's an inorganic, yes, inorganic way to treat. You give ivermectin, but conventionally, what people do is for, should I say it's an organic method now? But let's just put it this way. Some persons apply um,
vegetable oils. So
Okay.
any clean, yes, yes, any clean vegetable oil. When I mean clean now, the one that has not been put on fire. So
O-
they just put it down there, and it's very viscous. So what the vegetable oil will be doing is it wouldn't really eradicate the parasite. Let me put it that way. It will not eradicate the parasite, but it will help the wax that the parasite has built in there to fall off due to its lubricant properties. Let me put it that way. So you do this usually in the morning and in the evening. Or if you're putting maybe more than a meal, or maybe you're putting 2 meals, then it's advisable you just do it once a day so that the oil doesn't get deep down into the ear canal of the rabbit and it becomes a problem. So
Okay.
that's just, yes, that's just an organic way of doing that. Um, so the inorganic is a normal conventional ivermectin, which we use to deworm and treat against ectoparasites.
So
Well,
is this
our
administered orally or injection? I
yes.
don't know what.
Now, when you're treating with ivermectin, there's the oral ivermectin and then there's the injectable ivermectin.
Okay.
Usually, for the oral ivermectin, it's usually prescribed 1 ml to 1 liter. So if your rabbit take, um, let's say 50 liters, you're going to be giving 50 ml. But the disadvantage of giving medications orally is that it takes a lot of time before they get to the bloodstream, which will show effectiveness. But unlike the injectables, when you give subcutaneous, that's under the skin, it goes directly to the bloodstream, and then you have effectiveness of that medication as soon as you inject the animal or the rabbit with it. So that's just the disadvantage. So if you want to prevent, it's best you give orally. Or if you're treating, as the case might be an emergency, then it's best you give the medication via injectables, be it intramuscular or subcutaneous. So that's just that for EMI.
Okay, thank you very much. That was a whole lot. That was a whole lot. Within just a very short period of time, he has literally trust everything that has to do with ear mites. Okay, so without wasting so much of time, we'll be moving on to the very next thing. And the next thing we have on our list here is epilation. Epilation,
Okay.
yes. So I don't know why you are actually laughing, but well, the floor is yours, sir. Let's hear what you have to say about epilation.
So epilation, or let me say alopecia, can be as a result of many things. But since our discussion is streamlined towards diseases, I'll just talk about the normalities, then I'll digress or move deeper into the parts of diseases. So when you say epilation, or once you say alopecia, in common terms, it just means the animal is losing fur, or it's losing hair, or losing feathers. The protective cover is being lost. That's what alopecia or epilation means. So
Okay.
what are some of the things that causes alopecia? In rabbit, you have closeness to kindling. So when you have a doe that's close to an EDK, that's an expected date of kindle, you might have cases of epilation because hormones are beginning to rise, and then everything is beginning to kick in place in preparation for kindle. And one of those things include looseness of fur from the hair cells. So the grip is lost so that it can enable the doe to pull out fur more easily to prepare a nest for a kid. But that's by the way. Another thing that uh, you know we would focus on in this discussion is what causes epilation in terms of health matters. So it's just a very huge load of ecto or endoparasites. So once you find out your rabbit is epilating more frequently than it should, you have to put yourself into asking what's wrong with this rabbit. Is this rabbit having a download of parasites in it? Another thing is rabbits usually molt from time to time. So molting is very similar to epilation, but you have to check your track record so that you don't mix them up. So once they are molting, rabbits sometimes molt after every 2 to 3 months. And molting is just simply change of food. So the old fork goes off well, another fork comes out. They will usually molt when the weathers are very, very cool so that you can get new food that will be able to trap more heat if their body or their temperatures warm. So don't confuse molting with epilation. Once you're looking at a case study of epilation, you find out that epilation is all over the body. Epilation or alopecia. When you're checking molting, it can be around the loin. It can just be within a specific period. When it molts, then it goes to another period, another place in the body or another part of the body. When you're checking epilation, when you're checking alopecia, you find out that it is all over the body. So just to dive in, it's best to give suspension medications like, what do they call it now? Albendazole. Yes, albendazole is a suspension. So when you're talking about, when you're talking about medications that are suspension, that means you put them in the mouth of the animal directly yourself. You don't leave the animal to take it maybe from the drinking trough or the nipple or whatever water systems you're using. So suspensions, you usually give them in syringe. So you just open it according to the body and weight of the animal, and then you put the medication into the mouth of the animal and allow it to swallow. So you can give albendazole to treat alopecia, and you can also give ivermectin, which is injectable. And we said the method of doing that is you giving subcutaneous, that's just underneath the skin. So that is your inorganic way of treating alopecia. And also, yes, also if you want to prevent it, you could also give pawpaw leaves. It's a form of deworming the rabbit. You can give pawpaw leaves, but you should take note that you wouldn't give that to pregnant rabbits. And even the inorganics, that's the ivermectin and also albendazole. It's best you keep it away from pregnant rabbits, as they have high tendency to lose or abort pregnancies when you give them such things like albendazole or ivermectin. So that is, I think, that's for epilation.
So in essence, epilation has something. It has a close tie with worms. Then.
Yes, it does. It does.
Okay.
It does. It does. Yeah.
Right. All right. All right. Thank you so much. Well, so our listeners, our viewers, and all of you, I hope you're actually having a lot of fun as much as I am having right now in the studio here. Really, really having a whole lot of fun. This is value packed. And yes, Miss Oma is actually backstage, and she was actually correcting the pronunciation of epilation. I actually got it a little wrong. Yeah. So That has been noted. I have actually picked that up. Okay, so moving on to the very next thing on the list, the very next item on the list. Now I'm actually a bit more conscious. Is mastitis. Did I get that right? Mastitis.
Yes.
Mastitis. Okay, okay, okay. So you're the expert, so you let us know. All right.
Okay, so mastitis. Some people call it mastitis, some will say mastitis. But however
All
we
right.
choose to call it that, yeah, that's totally okay. So simple terms, in simple language, on mastitis is just inflammation of the udder. But we really say rabbits have an udder kind of breast system. So we'll just see inflammation of the mammary gland. So what
Okay.
it does is, yes, mastitis is very peculiar to rabbits that are almost at their kindle date or rabbits that are already breastfeeding. So it affects the mammary gland and then it starts to, parasite starts to form like a pus kind of build-up in the mammary gland. So one thing you will notice is the hardiness of the mammary gland, sort of like lumps within the mammary gland. So rabbits will usually have teeth lined up vertically,
Okay.
maybe four. Sometimes if you have rabbits that are very good in terms of maternal instinct or hereditary characteristics, you find some having maybe a pair of five, while some a pair of four. That's
Okay.
10 and 8 respectively. So
Okay.
mastitis is just prone to dose. It doesn't affect male animals. Doesn't affect male animals. But what we do is we it comes in grades actually, and it's very very painful, very very painful.
So are you saying
Mastitis
this is
can
something
be
that can
very,
actually lead to death?
yes, it can, because one thing you need to notice with mastitis is that as it comes, so does emaciation. So you start to notice very very visible weight loss within your rabbit. You start to see a lot of weight loss because the parasite keeps destroying. Yeah, let's put it that way. It keeps destroying cells within the mammary gland. And then another thing is, if the doe is with kids, you find out that their growth rate becomes very, very slow because lactation is not properly done. And even if they try to suck, the outlet of milk is very, very small. So you have very, very small deposits of milk that is not able to sustain them to when they start eating. So what we do when we're treating mastitis, we give an antibiotic. They call it pyroxicam. So pyroxicam is anti-inflammatory because anything that has to do with mastitis is inflammatory. Because once the parasite gets into the mammary gland, it starts to inflame that cell. And anything inflamed is like swelling. So we give pyroxicam. Usually treatments are done for
Um,
a period of
Sorry, could you
months.
please get that again because the connection there was a bit glitchy. So you said you give what?
The name of the medication is pyroxicam. It's spelled Piroxi, then cam, CAM. So
Pyroxicam.
it's, yes, pyroxicam.
Okay, pyroxicam.
Yes, pyroxicam. So you give pyroxicam to treat against um what do they call them? Mastitis. So we have what we call, there are certain types of what do they call them now? I'm trying to put the name here. they call them topical anesthesias. So when you're talking about something like topical, just like the name implies, top, it's not tropical, it's actually topical. So
Okay.
you put the anesthesias on the infected area. You just use a gauze. A gauze is just like cotton wool. So you just apply it and then it numbs the cells around the affected area for some time. So the essence of you doing this is so that you can press out the pus out of there.
Okay.
Yes, so that the rabbit can get some relief. So when you've done this, then you can give pyroxicam, and you can also apply a little bit of maybe penicillin um, there, and then you can also give dexamethasone. That's also anti-inflammatory. But we
Dexamethasone.
don't usually, yes, we don't really prescribe it a lot because it has this weakening effect. Most times when you give the animal that doesn't have a very strong immune system, you find the animal going down easily. Maybe the medication will kill it faster than disease is having. So we don't really encourage the dexamethasone. It's not, maybe in very rare cases, but also an alternative if your animal has a very good immune system. But usually we need pyroxicam for such cases. So I think that is that for mastitis. I'm not certain of any organic method. The best the best thing I know they give for organic method, not really to treat against mastitis, but in order to keep the mammary gland in check and also for excellent milk production is moringa leaves. So you
Okay.
can give moringa leaves, yes,
I was actually just about to ask that.
yes. So you can give moringa leaves for excellent or adequate milk production, and also check balances of colostrum levels, because that's one of the major things your baby rabbit or your kid or your weanlings will be needing for their first at least 6 weeks of existence. So
Okay.
moringa leaves are very good for that also, yes.
So earlier you said you mentioned penicillin. Does that mean that mastitis is actually on what's it called now? It's caused by bacteria.
Yes, it's caused by bacteria actually.
So how do
Caused
these
by
rabbits actually
bacteria.
get infected by this?
It's usually from the surrounding environment. Usually when you have cage system or a food system that is very, very much untidy, you find bacteria creeping into the teeth. Teeth have very tiny holes that are controlled by a nerve system. So these bacteria are microscopic, so they creep into the teeth opening, and then inside of the teeth they start to form their habitation. And one very common adaptive measure of microorganisms is their ability to reproduce very fast because of how tiny they get. So the lump you feel when you take a rabbit or an animal with mastitis
Yeah.
is actually a result of that fast reproductive ability, that microorganism. So
Okay.
that's what that bacteria does. Fast reproduction, uh, uh, fast spread. Yes, because once they reproduce, they try to trace their habitation all around that cell. Or no, let me not say that cell, that organ, because the breast is actually an organ. So they try
Okay.
to inhabit that whole organ to make sure that there's complete dominance. So that every nutrient, vital nutrient coming there, they will be the first partakers, not the babies. So that's
Okay.
what, yeah, that's just the mechanism of how the bacteria creeps in and how it multiplies. Yeah.
Wow, that is really, really that's a lot. That's like that's a lot. Okay. All right. With this, I believe we've actually come to let's say halfway. We still have a couple more to go, of course, but then at this point we're definitely just going to go on a very, very, very short break, just a few seconds or few minutes depending. Yeah, so of course we'll be back with the remaining section of the show, the remaining diseases that we're going to be talking about. And of course, I remain Salem Ochidi, Ecoville Farms. Of course, if you haven't subscribed to this channel, please do well to leave us a like or subscribe or even a comment, okay? Whichever one works. Or you could also share this to a rabbit farmer who is also interested in, who this knowledge would actually do so well with. All right, so let's go ahead and do that now. I'll see you in a very short while from now. See you. All right, welcome back. Welcome back, everyone. Welcome to the show. Of course, if you're just joining the live, we've been talking about inorganic and organic approaches to rabbit diseases. Okay, so so far we've actually talked about really, really interesting diseases, really, really interesting solutions. Okay, and I would say, well, so far it has been really, really insightful for me, like so much insightful. And we've had Adeiza of Adeiza Rabbitry on the line. Okay, so we're definitely going back and we're continuing picking up right where we left off. All right, the very last thing we were talking about was mastitis, and he gave so much, so much, so much. So yes, moving on to the very next item on the list, we're going to the section where we're going to be talking about mucoid enteritis. Okay, so mucoid enteritis is the next item on the list, Mr. Adeiza.
memory stage. So when we talk about mucoid enteritis, I'll I'll just try to break break it down. So mucoid means mucus, coming out with mucus, while enteritis just simply means dysentery, just having a diarrhea. So mucoid enteritis, that means having a diarrhea that comes out with mucus. So what causes mucoid enteritis? It's actually caused by protozoan. Yeah, it's caused by
Protozoan.
protozoan. Like, yes, things like malaria. You have like malaria intestinally. They're the ones that break down the mucous wall of the um of the cecum, which is a very vital organ in the guts of the rabbit. So what they do is, that is their prevalent site. So the bacteria, not the bacteria now, the protozoan goes into the cecum, and then it starts creeping on the walls of the cecum, and then that's how you have that mucus. The mucus is meant to have the function of lubrication, so that when waste or feces are coming out, it won't be difficult for the animal. But what the protozoan does is that it creeps on that mucus, and then you have a breakdown of the mucus there, and also very watery diarrhea. So
Okay.
mucoid enteritis most times is not fatal as coccidiosis. You can have an animal that's maybe having mucoid enteritis, but you still see it having its appetite, you still see the paw looking a bit shiny, but it's just discharge that would be much. And when you want to know the severity of mucoid enteritis, when it has reached the final stage, that's when you start having a dull fall, you start having a graduation of that enteritis into just plain diarrhea, which is coccidiosis, and then
So
you,
these are these are two different cases, not
yes,
multiple stages of the same case. I don't know if you get what I mean.
yes, but they are not independent of each other. They
Okay.
have to, because
They are
enteritis
connected.
in rabbit, yes, enteritis in rabbit has to do with the key term, which is cocci. So you having that mucoid enteritis just gives you an indication that it's still at early stage. That's what I was saying earlier, that even when you have them passing out that um, mucoid kind of stooling, you
Yes.
still have them eating well, you still have them drinking well, their force still looks okay. The only thing you notice that is abnormal is that mucus in their feces.
Okay, so that
But
is the
once they
case of
graduate,
mucoid
yes,
enteritis.
exactly. So what they do is that when they break down the mucus, then they start to break down the stool itself, and then you start to have just diarrhea, just
Okay.
very watery, smelly diarrhea. So once you want to mucoid enteritis is mostly, there's something I wanted to say. It's actually very much prevalent during the rainy season,
Okay.
because
Is there a
the
reason for that?
parasite, yes, there's actually a reason for that. The parasite stays in a cyst. So during the rainy seasons, we have very high levels of humidity, and
Okay.
then there's very much abundance of water in the atmosphere, and even within drops physically.
Yeah, that's
So
true.
water helps with breaking the cyst. Once there's water on the cyst, which is very microscopic, it breaks or it bursts, and then the protozoan parasites are released within the environment of the rabbit, and
Mm.
then they get into the system via engulfing, maybe um,
To
engulfing
their
through
feed.
the water bowls,
Okay.
yes, or their feed. That's
Okay.
why we always advise that you keep your drinking troughs very clean. You
Okay.
cannot be 100% clean, but
It's a
you have to make
preventive.
sure that you have, yes, it's that way. You have to make sure that the parasite buildup is less or very much controlled than having it multiply due to carelessness or lack of sanitation. So that is just a simple way I think I can explain how the cyst breaks and then gets into the body of the animal. So once you want to treat against uh, mucoid enteritis, now I'll state this because this will serve as a dual function for mucoid enteritis and coccidiosis. You simply give, some persons will give enrofloxacin, and others will also give oxytetracycline, which helps with the diarrhea. Then
Okay.
you can also give some multivitamins because there will be a huge lot of appetite loss, and
Okay.
you can deworm also because sometimes the ectoparasites and the endoparasites have a very good advantage when the immune system is down. So you can give those three medications. You can deworm with ivermectin and or albendazole, and you
Okay.
can give oxytetracycline or enrofloxacin, and then I think that's just pretty it.
So you
You
said
should be able to,
oxytetracycline
yes, oxytetracycline,
or
enrofloxacin,
enrofloxacin.
yes,
Okay,
enrofloxacin,
enrofloxacin. Okay, okay.
yes, yes,
Antibiotic, I think.
yes,
Okay.
exactly,
All right. So that's most likely a broad spectrum antibiotic.
exactly,
Okay. Okay. So
yes,
um, I actually wanted to drop this a little earlier. So basically, we can actually say that mucoid enteritis is basically
in an
stage
early
one,
stage,
and then stage
yes,
two is coccidiosis.
coccidiosis,
So
very true,
while treating mucoid enteritis, you might not necessarily need to employ the use of the multivitamins because at that stage they might still have good appetite.
yes,
Okay,
yes,
however, when
you
it
might,
crosses over to coccidiosis, it's mandatory for you to include multivitamins because there's going to be a great decline, a huge decline in the um in the appetite of the particular rabbit.
exactly,
Okay.
that's just it,
Whoa,
that's just it,
guys,
yeah.
I'm really learning. I'm really learning so much, like so much today. Look at me. All right. So thank you so much, Mr. Adeiza. We still have, I think, a couple left on our list. So we're just going to be moving on to the very next thing, which is snuffles. Snuffles. I think quite I don't know how many rabbit farmers have actually experienced this, but I think personally I have experienced this. I remember the very first time I saw a rabbit with snuffles. I began to panic actually because I was wondering, I was like, is that even possible? Like watching a rabbit, sneezing, having those, it kind of looks like allergic reactions and all that, like it's coughing, it looks really cute and all that. So yes, talking about snuffles, what do we have to say about snuffles?
Yeah, so snuffle is a respiratory kind of disease, mostly caused by bacteria. Sometimes it's also caused by Pasteurella, also known as Pasteurellitis. So another name for snuffles is rhinitis or rhinitis. However, you choose to pronounce it. One thing you need to know with rhinitis or snuffles is you need to be very, very cautious in terming it as what it is because it doesn't affect rabbits that are below 12 weeks old. So snuffles will never affect rabbits that are below 12 weeks old or rhinitis. So it's caused by bacteria that takes advantage or dwells mostly within the nasal area of the animal. and sometimes within the lungs, or most times rather within the lungs of the animal. So snuffles is just difficulty with breathing or hindrance in breathing due to the prevalence of parasites within the breathing route. So
Okay.
if you want to if you want to check an animal that has snuffles, you see constant sneezing. That's one of the signs and symptoms. There's very much constant um, sneezing in that animal.
Okay.
Just like we talked about mucoid enteritis, it's something that is very prevalent during the raining season. But once you have to talk about snuffles, it's much prevalent during the dry season where you have wind um, blowing through your watches as frequent as they can. And
Okay.
it's more airborne than waterborne because it blows the bacteria towards the animals and then they just
Inhale.
inhale them, yeah, inhale them, and then you have a very huge, you know, um, buildup of that parasite within the nasal area. So snuffles cannot, yeah, it can kill because from the nasal area it gets to the lungs, which is one of the primary organs that has to deal with breathing.
Okay.
So how do you treat against snuffles? It's very simple. We give medications such as Tylenol. So
Tylenol.
Tylenol, yes,
Okay, Tylenol.
Tylenol is there. Yes, Tylenol is there, and there's also Tylosin, which is very
Tylosine.
conventional and very popular. Yes, Tylosin.
Is this something that is would you call it antihistamine, or is it related to antihistamines that are prescribed to humans?
Yes, I would. But just like let me just give samples of um oxytetracycline. Some of
Okay.
them you see the percentages for capsules now, you see some percentages like 20%, or maybe if you're dealing with another medication, let's just say embazine port, you can see the percentage of sulfur is very less because they have to with smaller animals. So like
Okay.
that which we were talking about, the percentages in terms of human anatomy would be higher than that of the rabbit. So you might have the same active ingredient working for the both um, species. Let me put it that way. But one is higher than the other because once you give the higher percentage, you find that overdue or overlap body of the smaller animal, and then you have death because the animal is overwhelmed by the impact of that medication. So I think that's just a little address on what you asked. But you give Tylosin, you give Tylenol.
Okay.
Those are very effective drugs against respiratory issues.
Okay. Are they
Most times you
given
give,
orally?
yes, you can get oral Tylosin and you can also get the injectable. But unlike that of ivermectin, you give Tylosin intramuscular, not subcutaneous.
Okay.
Yes,
So would you
yes.
say that the injectables are way more effective in terms of speed compared to
Yes,
the?
I would definitely say that because when you're dealing with injectables, it goes directly to the blood vessels. So there's absorption of the active ingredients, and then um, the work of that antibiotic or the work of that medication starts very effective or very immediate. So unlike the orals, it takes time before it gets towards digestive walls and absorption starts to take place. It's quite a lot of time, and if it's something very severe, you might lose the animal before you start to get immediate response from what you've given the animal. So I would best advise that if you can, you should always give injectables. But the vet is always your friend. We don't advise you treat except you have that experience. But if you don't, the vet is always there to put you through these things and to be of assistance at any time. Although most vets in Nigeria, let me say West Africa, are not 24/7, but certainly um, you would have vets that will be willing to help and to render services as such.
Okay. Thank you
Yes.
very much. Snuffles down. All right. So moving on to the very, very last item on the list, what we have here, is conjunctiva, conjunct, conjunctivitis. Well, I'm not a medical personnel, so most of these things are really difficult sometimes to pronounce. But yes, conjunctivitis. I think it has something to do with the eyes. So, what's it really? How do you actually pinpoint a rabbit which is or the rabbit that is actually about suffering that, or just in the early stages? How do you actually pinpoint them? What's the symptoms?
Okay, so the first symptom of conjunctiva is what we call epiphora. So epiphora simply means teary eyes. That's a rabbit having constant tears coming out from the eyes. So that's just the first sign you notice for conjunctiva. You find out that the rabbit is always teary, it's constantly blinking its eyes due to that discomfort of tears coming out from the eyes. So what causes conjunctiva is actually bacteria. Bacteria is responsible for causing conjunctiva. There's nothing really much about conjunctiva. The further stage is where the iris of the animal gets a little bit blurry because the bacteria must have covered the penetration of light coming into the eyes of the animal. So you find it looking very pale. If it's in animals that are that's ruby-eyed white, like the New Zealand white, Himalayans, Californians, um, a bit of, let me just say, bit of maybe which other breeds now? New Zealand, Californians, um, maybe I think I've mentioned Himalayans. For any rabbit that comes in real phenotype, you find out that that pinkish eyes turns into white color because of
Okay.
the presence of that bacteria. Yes. So what you do is you actually give gentamicin eye drops. Now gentamicin is used to treat gram-negative bacteria. So just for gram-negative bacteria, you have gram-positive and you also have the gram-negative bacteria.
Brown negative,
Yes, gram-negative.
gram
But
negative.
yes, when you're treating conjunctiva, you use gentamicin. So you just go into any human pharmacy. They rarely sell it in veterinary stores, but you go into a human pharmacy and then you just um, make purchases of that gentamicin eye drop, and then you put 2 drops of that eye drop in the eye of the rabbit um, twice daily. Yes, twice daily. It could be in the morning or in the evening, depending on your work schedules, actually. So I'm not certain of any organic method of treating conjunctiva, but I know, and I've used it severally on my farm.
Okay.
I know, and I'm very certain that gentamicin does the eye magic for conjunctiva.
Okay.
Yeah, so that's just pretty it for conjunctiva. It's very much a delayed process. So if you can tackle it as early as you can, something that wouldn't metamorphosize to something detrimental. So conjunctiva is not really a big blow
Okay,
in
so
your rabbit farm. Yes.
it's not something that is health or life threatening.
No, no, it's not life threatening.
Okay.
It's not chronic. Yeah,
Okay.
it's not chronic form. No, it's not.
All right. All right, Mr. Adeiza. Thank you so much. Thank you so much. This has been very packed. But then we've
You're welcome.
we've actually taken quite a bit of time. Of course, we started pretty late due to technical difficulties, but I'm really glad this has actually been able to come. Of course, if you're just joining us, we have spoken about quite a bit of rabbit diseases and inorganic and also organic solutions to these rabbit diseases. Of course, if you have any questions, you could definitely still reach out to us in the comment section. If you're watching a replay, of course, you could still, go back, go through all those things, study them, let us know what you think. And if you haven't liked, do well to leave a like, drop a comment, like I already said. And of course, don't forget to hit the subscribe button and the post notifications because we're going to be coming live again very soon. Keep your eyes on the channel. All right. With that being said, thank you so much for joining the live, and I would be glad to see you when next we are live.